Pharmacists are society specialists on drugs. The pharmacist of today is a drug maker, drug dispenser, drug custodian, patient counselor, drug researcher, and drug educator, and above all, an honest and patriotic citizen. The pharmacist is the bridge between a physician, surgeon, and patients who counsel and advise the patient to maximize the desired effect of the drugs and minimize the untoward adverse effects of the drug. The techno-proficient foundation of the drug expert gives him or her the certainty of providing services with a moral way to deal with the satisfaction of patients. The consecrated qualities are required to be cherished and professed by the pharmacist. They are experts in the activity and use of drugs, including the chemistry, pharmacology, and the formulation of medicines. They are the healthcare professionals who have the responsibility to give essential consideration to the patient and giving protection and providing safe and effective use of medicines. Pharmacies are responsible for ensuring the right drug to the right patient at the right time, in the right dose, through the right route, in the right way. Today, we'll be discussing the role of pharmacists in meeting global health needs. Stay tuned. It's another day with the physicians where your health is our business, and of course will always be our business. My name is Dr. Martina Agbere, your regular anchor on this program. Today we'll be discussing the role of pharmacists in meeting global health needs. And in the studio with me is no other person than our very elegant PHARM Charles OYENIYI. He is the MD, CEO of Drug COMSULT Pharmacy. Welcome to the physicians.
Thank you very much.
You look really good. African, pure, proudly Nigerian too.
Yes.
Welcome, welcome. So we want to talk about the role of pharmacists in meeting global health needs. Of course, you're a pharmacist, so there's no other person who is going to discuss this and to let the public know exactly all that we need to understand about the role of pharmacists. So can you please introduce yourself and share your experience as a pharmacist?
I'm pharmacist Charles OYENIYI, MD CEO of Drug COMSULT Pharmacy. I have worked in the hospital for a decade before I left and set up my own community pharmacy to be in the neighborhood, because I see where to add value to people after getting the experience I've had in other sectors. So I set up Drug COMSULT Pharmacy, and our basic need and our goal majorly is managing chronic illness and other sector needs.
Okay. When you talked about setting up in a community, so you have a community pharmacy, before I ask you to tell us what inspired you to pursuing a career in pharmacy, what is the difference between a pharmacy and a chemist?
In fact, I will combine those two questions. Why I decided to be a pharmacist. I remember when I was growing up, when you have any ailment, they will ask you to go down to a chemist down the road, and you will see just one man with a spoon counting some medication into a nylon and give. So those days, pharmacies were not that common. And that inspired me that this man that always just give you that drug that you don't want to take and nothing else other than just write one and dash on it. I want to get to know more about it. So that's the main difference, that there is a pharmacist is the person that is knowledgeable, that can counsel, dispense, and also compounds drugs in areas, whether there's a formulations that you can't able to get, they can able to give you that dosage form you want. So they are the custodians of the drugs. So they are different than just someone that have the knowledge of, oh, if you use this, it will work. So they knows all that it entails about the ailment and the right dosage, the right medications to give, and for what duration.
Okay, I talked about chemists.
So the chemists, they are just the ones that they have a little bit knowledge on what dosage form is this, and just to get this help in assisting the pharmacists.
They probably got trained on the job.
Yeah, they got trained. So, in fact, we call them patent medicine the dealer now. So they just got trained. So they only have the basic knowledge of the over-the-counter drugs.
You know, I'm laughing because you said they got trained and that's what they're chemists. I'm just wondering what they call the ones that carry the drugs on their head.
Or the hawkers.
The hawkers, and they sell everything.
In fact.
And that treats everything.
Those are the ones still causing a menace to us here in Nigeria. Because those ones just know that, let me combine all this. There are different hawkers. Even the herbs that you see people now, I've even found out that they put some drugs into all those things, just concoct it up, and at the end of the day, that's where we are having.
That is actually going to be a very interesting topic, because I recall that there was a time somebody who had diabetes, and they said the person is cured, and they gave herbs to the person. Apparently, they actually put a medication to lower, they put metformin to lower the sugar level. Well, that said, so how do you think pharmacists contribute to the global health needs? Okay?
Yeah, you see, the pharmacist has a lot of ways they contribute to the global health needs. One, in drug medication management, counseling of patients, in terms of also the barriers to all these drug medications, that is in terms of cost and the side effects. And also they do what we call the screening. Pharmacists also play roles in doing point-of-care testing and doing first, they are like the first contact when in the community where people come and they're able to screen you and know that, oh, at this point you need to see a physician, or at this point with this state, these are the medications which you need. So they have a lot of roles. They are vital in terms of meeting the global health need, because they are the custodians of these drugs and they know the technical know-how and reaching out to the patient with the right things to do.
Okay, I like the fact that you said in the community, when they come, you are actually able to check them, probably the vitals, and when there's a need, you refer them to see the physicians. Okay? So because we're beginning to, people are wondering the role of the pharmacists. In the past, they've always known that pharmacists deal with the drugs. When the doctor gives the prescription, the pharmacist will read and give the drugs to the patient. But now you see a lot of banner, a lot of information. Come here, check your blood pressure, check your sugar level. It is usually very good if they do that and they refer to the physician when there's a health care, when there's a need. Okay? But the challenge will not be when I don't know if you look at it like a challenge when they're now open and begin to consult because they know the drug to use. In rural communities, it happens.
Okay, you see, the role of the pharmacist have expanded beyond that. And like I said in my earlier, one of the major roles of also the pharmacist is making medication available even in the underserved area. But there is also a limit in whatever we do. Everybody has a role to play. So the pharmacists, most of the time in the communities, are always the first point of contact in which where they see. Now the role that I said have been expanded beyond that is also that they can able to differentiate that, okay, at this point of care test can be done and we know what this condition is and what to do, and where they need to refer to the lab or where they need to refer to the physician needs to be done. It's not that you say, oh, I can able to do this or another, but they are like a point in gap, an indicator to be able to let you know this is the right thing to do. Because if the pharmacist is not there, in fact, let me also add it in this way that many prefer to first come to the pharmacy before to go to the hospital, because when you look at the bureaucracies, the treatment of me getting down there, first getting the card and waiting in line and all that. So some felt that, oh, I just have this headache, I think I just want to buy Panadol. And it might be more than just ordinary analgesic you want to buy. But it's the pharmacist now to track that person and know that, oh, this is beyond this. At this point, you need to see a physician. I've seen a lot of people. That's why I told you that in our place, we concentrate majorly on the management of chronic illness. Where you've seen people just because they think they have that headache, it's just an analgesic they need. Meanwhile, we just check and find out that the BP has risen, that this thing is A severe case is a stage 3. At this point, you need to get to the hospital. But you know, they feel reluctant, they don't want to go and all that. But it's your role as a pharmacist to counsel, educate, and make the right referral to the right place.
Okay, so being in the community, so what initiatives actually have you been involved in to improve access to healthcare?
A lot of initiatives have been done. In fact, I can tell you that many people are working crops that they didn't know. But we are coming to the pharmacy whereby we make a point of duty to do a free BP check, which a lot of people, you know, you cannot just walk into the hospital that you want to come and do a BP check. Because many people know that for me to go to the hospital because I'm sick, but somebody that has a BP that doesn't know that he has a BP. But we are coming into the pharmacy, maybe just walk in and we can just say, why don't you check your BP? And at that point, we're able to check and able to identify such people. That's an intervention. And we're able to know that, oh, this thing is high. Can you please come back again the next day? You know, we check it constantly for 3 days and find out that this thing is high. Likewise, the same thing with a sugar level. You know, sometimes just complain that, oh, I've been urinating too much and all this. And just say, why don't we just give it a check? Let's try your random check first. Then maybe can you come the other day, do a fasting blood sugar check, and we'll just say, and we'll notice that, then we can able to refer. So we have been able to make such intervention because we are easily accessible to, and they know that, oh, these services we are rendering is just in there with their mindset that, oh, I'm not in the hospital in quote. You know, that effect that is only the sick people that goes to the hospital. But they know that when I come to the pharmacy, oh, I can just only want to come and buy just my analgesic, I just feel I have a headache. But the point that we have been able to intercept and identify, able to pick out.
Yeah, it's actually very good because in communities, I like the fact that when you ask them to check their blood pressure or sugar level, and you find out that it's above the limits that they need to see the doctors, I like the fact that you actually refer them. Unlike some who probably would take the laws into their hands and decide to prescribe medication.
That is why we need to continue to educate our people. In fact, a lot of people have ruined their health when they didn't get that prompt attention. A lot of people had stroke just because that promptness was not being done, because they feel that, oh, I can manage this. You know, in quotes, they're looking at the gain of the business aspect, but not knowing that we should put the patient at the first in front. What will benefit these patients? So when we see a case that needs a referral, that this is a red flag, we don't need to sit down and say that, oh, let's first still make the gain effect. But it's the patient we need to put first. Okay. So where that referral needs to, we do that. Okay.
So I want to say something. You know, a lot of people, they come to the doctor gives prescription, the patient goes to the pharmacy to pick the medication, and the first 2-3 days they feel good, right? And they stop taking the medication because they feel good, forgetting that it's supposed to be for a duration of time. Okay? So what strategies do pharmacists use in ensuring that patients adhere to the medication?
Thank you for that question. In fact, that is one of the reasons why a lot of people have been finding it difficult managing chronic illness. You know, when we say something, for example, in diabetes or hypertension patient that is on these drugs felt that, oh, my sugar level has come down, oh, my BP has gone down, not knowing that you need to take this drug for a longer time, that this is a chronic illness disease. Our role as a pharmacist is first, educate them, counsel them, let them first know the importance of this thing, that this thing is, we are managing it, it is not controllable. Because once you just give them the drug and they go and you don't counsel them, you have missed it.
Sure.
Because at that point, they just felt that I already feel better. In fact, ordinary malaria drug, you find out that people that are supposed to take it for 3 days, and because they use it for first day and the second day they felt better, they said, I don't need it. The role of counseling is a very key. Once you miss that part, in fact, you have failed the job. So that first thing is that we make sure that we ensure that we counsel, and then let them know the importance. When they know the importance, then the value has been added in there. To let them know that this thing is what we are going to manage it. So that means you're going to be on this drug for continuous one, and you need to continue to be checking. Because the number is dropping, is because you are using your drug. So that rule is very, very key and important.
I am actually very excited and happy because patients come, you see them, give them medication, and after 2 or 3 days, they are okay, then they stop using the medication. And you just talked about it now. But then, how about patients that have had some medication and another person has the same health condition, and the patient goes and buys the same drug and gives to that individual? I say, my doctor gave me this medication for my blood pressure. And the goes to the pharmacy, buys that same drug without seeing the doctor, and gives the medication to the patient.
In fact, we see a lot of that case. Let me give you a scenario. There is a patient that came in and said that, my BP drug now has been going down because a friend introduced me to one, but I'm beginning to have this side effect and all those things. And I asked the patient, can I see those drugs? Do you know one thing? This patient is on 3 drugs that are the same, but because they have 3 different names.
Oh, wow. The brand name.
The brand name is there, but you didn't know that we are taking the same drug. And so that's why it's now coming out with undesirable side effects. And he didn't know. In fact, if not because of that side effect that is already known, we won't know. So a lot of people take it because my friend is using it and say, this one is working for me, and I want to also use it. It's very, very common. Okay. And not even knowing whether there's an interaction that that one will take, and also, and that is where we, the pharmacists, must not meet that rule. That at every point in time we are getting in contact with that patient, we need to let the patient know that these are the possible side effects.
Exactly, I was going to say that, because if we're talking about adherence, right?
Yeah.
If the patients don't know the side effects of the medication, the chances are that they will stop it when they start experiencing some of the adverse side effects. So the pharmacy will also tell them, so it's for the patients to understand that when you get a medication, let the pharmacy explain to you the possible side effects. So that way, the adherence will be better than not even knowing anything about the side effects. You feel dizzy, you are feeling dehydrated, you're having diarrhea, you are having constipation, and then the next thing is, I can't cope with this drug anymore. You just abandon the drug. But I'm very happy that the pharmacy will be able to tell them some of the possible side effects, so there'll be good adherence. Let's talk about the challenges. So what are some of the common challenges to medical adherence that you have seen, and how do you address them?
Oh, there are a lot of challenges. One, when there are a couple of multiple drug medication for a patient, probably the one you're supposed to take in the morning and the one you're supposed to take in the night because of the nature of the drug. You need to pack all the ones you need to separate. The one you need to take in the morning, and need to let the patient know that this is the reason why you need to take this medication in the morning, because it's going to give you these possible side effects. You urinate a lot, so you don't need to take it at night so that it won't disturb your sleep. While the one you're supposed to take at night, you pack it also separate and labeled it and well written that there's a reason why you're taking this at night, because, oh, you are talking about antilipidemia, this is better taken at night because of this. That's one. Most of the ones that, again, that always been a barrier or a challenge is cost. In fact, I've seen a lot of people that they had issue. Some, it's only when they know that it's the next appointment, they want to now come to the pharmacy and buy that drug. So they will tell the doctor that I've been using my drug. And you find out that,
serious?
Why have you not been using it? That drug is very expensive. So cost can be a barrier. But when you know that cost can be a barrier, the possible solution is there are generics. You don't need to pick on the brand. Find the generics or alternative generics that is affordable to the patient. Because when a cost is there, the patient cannot be able to, for example, for a chronic illness patient that you are going to be on this drug for long and the cost is there, obviously you will just say that, look, I can't continue with this. I would rather go and find another solution, and that's where you get it wrong. So cost is also a challenge, which we need to let them know that there are that's why there are generics. There are other things you can use as the generics. Another one can be side effects. A lot of people have stopped their drugs maybe because of the undesirable side effect they are experiencing, which they are not letting you know. So it's always good for us to let them know that there are possibility of you having this side effect. You let them know ahead that when you have such side effects, let us know so that you can switch. For example, someone taking an ACE inhibitors, antihypertensive drug, and let the person know that there's possibility of you having a dry cough. And the person you didn't let the person know, and the person start coughing, and he has been using different cough syrups, and it is when I started this drug that is making you cough. I rather let this drug stop it. Meanwhile, you can switch it to another one that will not give that undesirable side effect. So ours is to let them know that these are the way to manage this undesirable side effect that you might experience with this drug. That doesn't mean you have to stop the drug. In another case also, we need to for the elderly or the pediatrics, their caregiver or the people that is taking their family members. So for the people that are old, we let them, the family, okay, you are the one that will be taking care of this. These are the drugs you need to give. Whether for the child, we need the caregiver to know that these are the time you need to give this drug. So those are the things one needs to watch out for. That is the complications of all the drugs, the cost, the side effects, and where they need it to be for the caregiver.
So when you tell them about the side effects, right, and on the need to see their healthcare professionals, or so that they could change their medication, because unfortunately there are some cases the people really do not even understand that it's the side effect of the medication they're using. They continue until they begin to have very serious side effects affecting the liver, affecting the kidney, and those are some of the class of people that really obey instructions. Okay, so I like the fact that pharmacists are able to explain to them these are the side effects, these are the consequences if you do not use your medication. For instance, somebody who is using medication for diabetes or for hypertension, and you are not adhering to it strictly, you have a challenge. For somebody who has ulcer, for instance, and you are giving medication, they will tell you don't eat, or eat this number of hours before this. So if they are able to enlighten them and letting them know the reason why they have to eat before a medication or not eat before a medication, it will also help too. So that brings me to, what are the innovative solutions you have seen or implemented in the course of your handling that?
Yeah, the innovative solutions we have implemented is creating a social media, or what we call a WhatsApp group. For example, if you have a diabetic patient, you can create a WhatsApp group for them, or maybe some people that want to do a weight management loss, create a WhatsApp group for them. So in that place, they can able to talk about their challenges, their possible side effects they are experiencing. Even in such group, we always let them know that this is the time to take this is the time to take that. So it's a new innovative because everybody has a phone. And so you let them know that, oh, we've created a club for ourselves, and it bonds them together. It makes them see that I'm not in this alone. And so that makes a uniqueness. That's one thing. Another innovative one is the telepharmacy. That's another innovation that I can also say that it's also working. You see, many people, you don't need to, you can be at the comfort of your office and able to consult with your doctor. It sends the prescription down while we get it to right there at our pharmacy and what being courier to you. So telepharmacy is also another innovative that is also limiting that adherence, because you know that there is no barrier or any limitations. So these have worked well, creating that social media platform for the need of those groups, and also whenever there can be a limiting barrier, and so you say a doctor, the telepharmacy is already also being in place, which is working.
So you have indirectly responded to how emerging trends or technologies have excited you, right?
Yeah, it is.
Telepharmacy, to understand. So for people to understand telepharmacy, you don't have to be there. You can use the WhatsApp, you can use your social media, and actually use your phone, okay, to be able to see your doctor. They send the prescription without even leaving the comfort of your home.
I'm telling you.
And the delivery will be there. So finally, so how do you see pharmacists' role evolving in the next 5 to 10 years?
Oh, in fact, pharmacists' role in the next 5 years now is beyond just the person that stays in one corner of a pharmacy outlet just dispensing drugs, but rather being an intervention, identifying the people in the community that needs to be referred, also doing a screening, In fact, vaccination now is being done right now in pharmacy in the era of the COVID that now came now. So now pharmacists are already being licensed to begin to start doing that, those that are trained for it. And also, we are seeing where the collaborations, where pharmacists is now working with the physicians and the nurses and the like, because like I said, the real goal is the patient that we have in there, and to see what will benefit that patient. So where you need to collaborate with other healthcare professionals in that role are all the things I'm seeing now that is working in place. Not like in those days that where it has to be just everything ends at the hospital or with the doctor. Now there's a collaboration, all working together.
I like the word collaboration. That is the way to go. Because when people work in different quarters without working together, collaborating, is a bit difficult. You have challenges.
Yeah.
Because this person is doing this one and going A, the other one is doing and going B, or the other one is doing and doing Z. And everybody begins to do the same thing in different ways. So if we see everybody as one, and the aim is to ensure that the patient gets the proper care, division of labor, the other person will not step into the other person's shoes and toes up, you know. So I believe collaboration is better instead of everybody working separately. And so that said, what message would you like to convey to healthcare professionals about the role of a pharmacist? In
a nutshell, what I want heading here is that we should always put our patient as the goal, and the goal is to make sure that the patient end up getting better when we all collaborate together as a team, working for the benefit of the patient. So that's where I want to end it. That's what collaboration. Collaboration.
So in collaborating, I also want to encourage and ask and request that maybe your body, the Pharmaceutical Society of Nigeria, maybe your body, the pharmaceutical body, should do something about the people that are hawking, do something about the ones that carry the drugs in boxes. And so thank you so much for being with us, staying with us all the time, watching your favorite Health TV talk show, The Physicians. Ensure that next week you keep a date again with us. Call somebody, that you can always benefit from The Physicians. Remember to follow us on our social media platforms, on Instagram, on X, on YouTube. We have a lot of episodes. You can binge on them. And if you want to be part of this program again, like OYENIYI, just send us an email and we'll invite you. The next time, my name is Dr. Martina Agbene. Stay blessed.
Every day and in every way, enjoy that I find support. No matter the role you play, nutrient pack supplement for you and me. In your body, that I fight you.
Darvite Nutritional Supplement is loaded with essential multivitamins, minerals, and natural ingredients that helps you to be at your best. Darvite from LB Pharma. Darvite, love yourself.